Welcome today. My name is Dr. Jeff Knight with True North Chiropractic and Wellness Center. Today we have a special guest with us, Tiffany Hendrickson. We're grateful for her to be here. And we're really going to focus today on helping people out that have those really tight hip flexors. The hip flexor muscle is actually one of the bigger muscles in the body. It attaches down here on the middle part of the hip, and it actually will go up through the abdomen and attach to the spine. A lot of times when people are feeling back pain even, sometimes they think it's, the best thing to do is just to stretch down and do that, when in reality it could be the hip flexor that's a problem. So we're going to just do a series of just a few simple exercises for any of you athletes or anyone at home that's interested in improving hip mobility and even potentially decreasing some low back pain. But they're really simple things you can do in your own house, but grateful for Tiffany to be here, and proud of all of her efforts and what she's been doing with CrossFit and representing our community here on a regional level, which is pretty awesome. If you don't know much about Tiffany, she's competing regionally in CrossFit, so we're proud of her, so good job.
Thank you.
So the first thing, if you could just lay on your back and have your knees bent and feet flat on the floor. And this first exercise I call frog legs. And I do want to just kind of put a shout out to a good group that I used to work with in Portland called Adapt Training, Portland, Oregon. They're a phenomenal group that I did a lot of work with, and they helped me a lot with these types of routines. So. But this one is called frog legs, and the first thing is just simple hip mobility, allowing the knees to drop and then bringing them back together, and doing that several times, up to about 20 times actually, is a really good thing. You might feel a little popping in the hips. If you do, that's pretty normal. As long as it's not really increasing any pain, you should be fine. And this is just a good, simple kind of introductory way to get some increased hip mobility. So after doing that for about 20 times, then I would have you go ahead and do kind of these marching in place, exactly just like what Tiffany's doing, a couple inches off the ground. And this is just kind of waking up those hip flexors a little bit. Typically, when people think of range of motion, they always think of stretching right away. I really like to focus on getting the muscle introduced a little bit through some action, and then afterwards doing stretching. There's a law called reciprocal inhibition, where you have two opposing muscles, and when one is working, the other one has to relax. So in this case, hip flexion, when we're using the hip flexors a lot, the opposing muscle is the glute max, and that one has to relax, and vice versa. So when we get things fatigued a little bit, then we're going to go right into having her lift her hips up off the ground and squeezing the glutes, and then repeat that and go back down. So now we're activating the glutes, which is in return going to relax these hip flexors, and this is really kind of one of the key things, the key components to helping this range of motion improve. So doing this again about 20 times, and that marching was about 20 times on each leg. And so so we'll have her do this 20 times, really make sure to focus on squeezing those glutes, and that'll help relax those muscles in the front. And then even after doing that about 20 times, you can widen your feet a little bit and do a few more, up to 10 to 20 of these as well. And this is just a wider stance, getting the hips at a different angle, and exercising that glute at a different angle too. And so we're just kind of priming the pump basically, and getting things ready to go into improving some range of motion. I've had many patients do this that have had low back pain, and this has been something that's really helped them out. But also, the majority of people today are working at a desk for 7-8 hours at a time. They're in a their hip flexors are in a contracted state for that whole time, and that means that those are going to get tight and shorten and pull on that spine that can cause some issues. Plus, I know with you athletes out there that are pretty involved in working out, sometimes we forget about the importance of having good range of motion to have better function. So thanks, Tiffany, for doing that. Now, let's have you on your knees, and this is where we're going to be doing the stretches to really try to get into those hip flexors. So on this, you're going to be kneeling like this, keeping the knee over the ankle, and then really focusing on squeezing the back glute, because once again, when we squeeze that opposing muscle, the hip flexor is going to have to relax, and as you squeeze it and lean a little bit into it, you're just going to feel that open up and get a nice stretch, and this will help with that range of motion in those hips. And so this is a great stretch. I would recommend holding it for anywhere from 20 seconds even up to a minute. Of course, maybe ease into that at first. And you can do repetitions of all of these, up to 2 or 3 times, and it can be really beneficial. And then of course you would switch the legs, and same thing again, focusing on squeezing that back glute, which is going to allow that front hip flexor to open up and be nice and stretched, and really pay attention to that. Sometimes you might even feel a stretch in the quad, and that's normal as well. So another alternative, if you could stand up for me now, Tiffany, is getting into like a lunge position, just a normal lunge, and just get a real wide base. Good. And then you're just going to drop straight down, and you just hang out in that position. Yep, hang out right there. And again, another kind of, this one's a little bit more increase in demand since you're now on your feet. It requires some proprioception ability of balance, but this is also phenomenal too, where you can just feel it right in that hip flexor and hang out there for a little bit. You can come on up now. These are things you should be doing on a regular basis just to counteract the negative effects that happen when you're in that position for such a long time. Definitely come on in and give us a call, and we do free consultations for all new patients, even do a functional analysis and get into really the root cause of what's going on in your health. Our phone number is 801-447-1647, and look forward to seeing you here in our office. Once again, thanks Tiffany for being here.
Sure, thank you.
You guys have a good one.